The tarsus screw stabilizes the subtalar joint, preventing excessive eversion and displacement of the talus in hyperpronated feet. Hypereversion, sustentaculum tali drop, talus plantar flexion, and anterior translation occur in a hyperpronated foot. The tarsus screw assists in correcting hypereversion of the calcaneus, restoring it to its anatomical position. Use a curved tenotomy scissors for superficial tissue dissection and to decompress the sinus tarsi structures. Insert the 1.9 mm guide wire through the incision by hand and aim to the posterior aspect of the medial malleolus. Adjust the direction of guide wire if insertion into the sinus tarsi is difficult, or remove the guide wire and use Stevens tenotomy scissors to cut remaining fibers to reinsert the guide wire. Use trial sizers to select the appropriate screw size for correction while preserving talotarsal motion. Recommended to start with the smaller size. After the engagement of positioning sleeve, thread the trial sizer on the driver tip and place it over the guide wire. Position the talotarsal joint in supination for deep insertion into the sinus tarsi, aiming the sizer tip toward the posterior medial malleolus. Turn the driver clockwise to advance the sizer, keeping it aligned with the sinus tarsi. Avoid using the sizer as a reduction tool, and do not rotate counterclockwise to prevent disengagement. Use fluoroscopy to confirm screw position, ensuring the sizer is fully within the sinus tarsi. To change the sizer, unthread the driver by twisting counterclockwise, using sterile gauze if needed. Repeat trial sizing and motion tests with different sizers until normal talotarsal motion is achieved. Once complete, unthread the driver by twisting counterclockwise. Use dry sterile gauze if needed to remove the sizer. Attach the screw to the driver and slide it over the guide wire. Rotate clockwise under fluoroscopy to insert. Twist counterclockwise to disengage the driver, ensuring the screw stays secure with the positioning sleeve. The perfect alignment of calcaneocuboid joint confirms the success of tarsus screw surgery.
Oxen.